Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining me is Dr. Ian Leber, Chief Medical Officer of ProHEALTH, the largest independent physician-led healthcare organization in the New York region, to discuss navigating COVID-19 as a patient and practitioner and the future of virtual health. Dr. Leber, it's great to have you with us. Welcome to Trade Talks.
Thanks, Jill. It's great to be here. Thanks for having me.
And tell us about ProHEALTH and how the organization is helping patients navigate COVID-19.
Sure. So I appreciate the introduction. As you said, ProHealth is the largest independent physician organization here in the New York City area. We have over 1,000 clinicians taking care of patients across 50 plus specialties. We have 300 locations, about 30 urgent care centers, 2 ambulatory surgery centers, 13 imaging centers, our own in-house lab, and we just love being kind of the one-stop shop for all of our patients that we are responsible for. In regards to your question, COVID's been an interesting time for us, though I honestly think we've taken it head on. So when COVID started back in March, what we did was, when most other places shut down, we decided to make sure that we were still available and a resource for our patients because we knew they depended on us and they needed us. So what we did was we actually were able to continue care across all of our specialties to make sure the patients still had access. And what we did was we implemented some really efficient safety measures to make sure that when people did choose to come in and see us, they could do so in a very safe manner and they wouldn't have to worry. And that served us really well. We did, in addition to offering the traditional in-person visits, we did also implement virtual medicine visits. So those who either shouldn't come out because they were immune compromised or had other issues, but still needed to see a doctor, also had that option. And really at its height, we were doing over 3,000 virtual visits a day in addition to the in-person visits. So I think we did a pretty good job of keeping open. The other interesting thing that I think deserves mentioning is that because we have urgent care centers, people were very afraid to go to hospital emergency departments because that's where the highest concentration of COVID patients were. And most of our competition closed up shop. We actually expanded coverage and opened up 3 additional centers right in the heart of the COVID pandemic. So we're really proud of that, and I think we did a really great job.
Well, Dr. Leber, we're obviously coming into the colder weather in the Northeast, which directly impacts your region. What are your expectations for fall and winter and how the virus takes course? Because we're also going to have college students returning home for Thanksgiving and Christmas and then going back. And then, of course, there's winter break. And quite frankly, people are frustrated with having to limit themselves. But you know, the virus doesn't really care what we think or how we've been inconvenienced. For seeing that with the rising number of cases.
Yeah, no, it's a great question, Jill. You know, we are hoping for the best, but actually planning for the worst. And what we're seeing is that even before the students are home for their winter break and their holiday break, we're starting to see some hints that a second wave is coming. So we've done a lot of testing here at ProHealth, and actually we were one of the leaders in testing for COVID-19. We stood up a lot of drive-through testing centers. We incorporated testing in our own in-house lab. And to date, actually, since the start of the pandemic, we've done over 250,000 tests just here at ProHealth, which is probably the leading testing center here in the New York City region. What we're thinking is that we're going to see an uptick of COVID as people start to congregate more indoors. That's absolutely a nidus for spreading of the virus, as well as the travel that you mentioned, as well as fatigue. People have been locked down now for a long time, and it gets really hard to stay away from people. We're social creatures, especially around the holidays, Thanksgiving, Christmas, New Year's. People want to be together, but unfortunately it does put people at risk. So we're preparing for that. We learned a lot from the first wave. I think we did things really well. We implemented a lot of safety measures that I mentioned earlier, but we also realized that even with that, there's a lot more we know about the virus now that we're going to be using to adjust our tactics come wave 2, whenever that may come, which, as you mentioned, is probably going to be in the upcoming months.
Well, that's encouraging to hear. And realistically, even if a vaccine is approved in late 2020, when could it possibly be available to all Americans? Can it be manufactured at scale to support the demand?
Yeah, you know, that's a really difficult question to answer because there's a lot of variables that come into that. I want to start off by saying, you know, we've known about COVID for less than a year, right? A year ago, COVID didn't exist. The term didn't exist in the vernacular, and now it rolls off the tongue. Historically, it's taken, in best circumstances, 4 years to come up with a vaccine. We are now approximately 10 months into the COVID pandemic, and we have 10 vaccine candidates in phase 3 trials. That is unheard of. So it really is a testament to the scientific ingenuity and the attention that's been paid by both, our corporate partners and the federal government in supporting a vaccine. Whether it's going to be ready by the end of the year or not, I don't think anyone knows at this point, though again, we'll keep our fingers crossed and remain optimistic. I know the government has invested approximately $9+ billion into vaccine development. Part of that investment is with the understanding that whichever vaccine candidate gets approved by the FDA, that's going to have at least 100 million doses available within the first half of 2021. Now, that's only enough to supply about a third of the population, and that's maybe a best case scenario. But what we're seeing in the healthcare field are states planning their vaccine distribution strategies. So I know Governor Cuomo here in New York in the last couple of days released his blueprint for vaccine distribution and prioritization. We're involved in that. We're excited to be a partner to help vaccinate people. I also want people to know, I think as a physician, it's really important to know that we're doing the right thing for our patients. And there's always a lot of controversy around vaccines and people wondering, is it safe? Is it not safe? And as a physician, we like to deal with data. We like to deal with facts and not fear. And the good news is that there's a pretty rigorous system to test the safety of these vaccines. And even though we're moving at a pretty fast clip, just in the last couple of weeks, we've heard about 2 vaccine trials that were halted because of unanticipated side effects. And to me, I think that's a good sign. It shows that safety mechanism is working, and we're not just pushing to put out something just to say we have a vaccine, but really something that's safe and effective and something that's going to bring this pandemic hopefully to an end.
Yeah, I'm really glad that you brought that up because, of course, that's a question in everyone's mind. And I just want to say how appreciative we are to you, all the healthcare providers and frontline workers and scientific community for working as hard as they have at this incredible pace, virtually pivoting on a dime. So we are truly, truly grateful for everything that you've done for our communities. But I want to wrap up, Dr. Leber, on what you mentioned with virtual care, seeing over 3,000 patients a day. That's quite remarkable. Do you think virtual healthcare is here to stay? Can it coexist with traditional office visits?
Oh, 100%. I think what we've seen is this pandemic, the one good thing that's come out of this pandemic is it's been a catalyst to embracing virtual care. The virtual care is not a brand new concept. It's been around for several years, but it was like most new technologies kind of kludging along at a very slow pace. And then we had this event that forced us to embrace it. And I think now we're going to see virtual care not only continue to be one option for people, but grow in popularity and grow in scope. Technology is an amazing thing, and I think what we realized is there's a lot of great uses for virtual care in the medical space. There's a lot of things now that don't require a face-to-face interaction, and given the fact that we are seeing a lot of consumer-based behavior now in medicine where people are embracing choice and going for where not only they can get good care but convenient care. Telehealth and virtual medicine is a real great tool to use in that. I mean, the way I look at it is that if we have the technology, and we do, where a surgeon can perform a surgery taking out someone's gallbladder virtually halfway across the world via the Da Vinci robot system, that technology exists and is in use, then why can't I do your annual wellness exam or follow up on your lab results via an iPhone from wherever you may be, as opposed to you coming into the office for me to have that talk? So I think it's an important tool. I don't think it's going to replace traditional medicine. There is a personal connection that people have with their physicians, and honestly, that physicians have with their patients. They are our extended family, and to have that very intimate relationship where you expect a patient to share all of their most intimate details with you, I think you have to have that face-to-face relationship. That's an important part. And there are some things that can only be done face-to-face. For example, if a patient comes in and finds an unusual lump somewhere on their body, that's not the kind of thing that lends itself to a telemedicine visit. The physician really needs to examine the patient and touch that concern in order to understand, is it something I need to worry about or just a benign lump and bump that we all get as we get older?
All right, Dr. Leber, appreciate the insight. Thanks so much for joining us on Trade Talks.
Jill, it's been great talking to you. Thanks so much, and I appreciate all the time you've given us today.
You got it, and thanks for joining me. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.